appear. So what oncology massage is, so this was taken from the Society for Oncology Massage website. It is a massage that is client specific and customized, designed to meet the unique and changing needs of someone in treatment for cancer or with a history of treatment, cancer treatment. The massage is safe, and the plan generally revolves around the side effects that come with living with cancer, whether that's surgery, radiation, or chemo. Side effects can last a very long time, as some people may know, and we learn how to roll with the punches, so to say. In my training, we learned how the cancer grows, what goes on when you get that when you get that diagnosis, the treatments itself, what happens during those treatments, and just learning how to deal with whatever may come up. You may have surgery and then just go radiation, or just chemotherapy, and what happens at those various stages, because each stage brings its own challenges. We also modify the massage because your bodies are also going through a lot of stuff. Your body's already trying to fight the cancer, and then the doctors give you chemotherapy and they do surgery, and this all affects how the body works. And so we modify the pressure and modify how we do things. The benefits, as you can see here, research has shown that it can help with pain and the fatigue that comes with chemotherapy, as well as nausea and the depression and the anxiety that does come with a diagnosis. So what makes oncology massage safe is, we won't work on things like the tumor site. If, your cancer is somewhere specific, we may just hold our hands there instead of actually doing a lot of work. And we're not going to work like around the port site, because that can actually affect how the port lays on your body. And we will be cautious of radiation areas, because that can be radiation, you're being burned generally. And you don't necessarily want to aggravate that area, and lotion can sometimes be aggravating. And I will apologize to people, I was a little nervous doing this today. So if I stumble, bear with me. So we will also be cautious because lymph nodes may be removed during surgery, and that can possibly cause problems down the line. You may get warned that once a lymph node is removed, that kind of backs up the system, which can cause lymphedema if it gets too stressed. And again, we're cautious of the tumor sites. We don't want to be just poking at the tumor site. Just not a great thing to do. And the pressure is gentle, because like I said, your body is already stressed due to chemotherapy and radiation. And we're just here to relieve stress and calm the nervous system. It's not necessarily about taking care of like the pain in your shoulder. It's about relaxing the body and helping your body cope with what's already going on. We also position for comfort. There may be different ways that we could lay you that may be uncomfortable. And so we will reposition you so that you're more comfortable. And that looks different in different people. We will use bolsters, pillows, extra blankets to put you in that perfect spot so your body doesn't hurt. What that could look like is kind of like these. As you see, there's pillows, there's towels, there's blankets, everything to make sure that your body is comfortable while we are working on you. So with the pressure is subjective. I'm sure we all realize this. But what's heavy for one person may not be for another, and vice versa. How we deal with this is by we have a scale that we can go by. It was made by a woman named Tracy Walton and other people massage therapists who were working clinically with other people in a hospital setting. And they realized that how the hands lay on the body can actually be judged as on a scale. So very light pressure is just like a very light touch, just on the skin. If think of like a butterfly landing on your hand, that'd be like the light touch. And then a little bit further, just a little bit more of the skin is affected. Medium pressure is starting to affect muscle, and so on and so forth. And again, we use lighter pressure just because your body's already going through a lot. Our bodies are always going through a lot. When you're fighting cancer, or whatever word did you use, you're going through chemo, which is rapidly changing your body. Surgery makes sure your body starts trying to heal itself, which is already all really difficult. We use light pressure so we're not aggravating that even more. We just want it to calm and to let it do its thing. We don't want to add to that stress. So I did put in slides on what to expect on your first appointment and during an oncology massage appointment. We don't necessarily have to go through these just because it's general knowledge. Come in with comfy clothes, know that you're going to get asked some questions with paperwork. Your massage therapist will lead you through the process. They will tell you, how to get on the table, how to get off the table, when to talk, when not to talk. We're all different. So we also do intake, which is, asking questions, because everyone's story is different. And we want to make sure that we keep you safe. We don't want to do any more harm than what the cancer's already doing. But we also want to keep you comfortable. So what we want to help you avoid is like discomfort from the port site. I know that the port can be uncomfortable at times. And I will put when I'm working on people with a port, I will put like extra padding there. If you're uncomfortable on the massage table, we just add extra pillows and everything. And we also want to help you avoid lymphedema, which is a different discussion on a different day, but we oncology massage therapists learn how to not aggravate the system so the lymphedema doesn't start. And does everyone know about lymphedema? I'm assuming that everyone probably does. So as you see, once damage to lymph nodes happen, either by removal or radiation, there will always be a risk of lymphedema, and that's something that doesn't go away. It can be helped, but it doesn't go away. And it can, signs of lymphedema can be swelling, a feeling of heaviness or tightness, aching, discomfort, and a restricted range of motion. So once the intake process is done, we'll have you get on the table, undress to your comfort level, whatever that looks like. Some people aren't comfortable taking off clothes, and that's perfectly okay. And we will make sure that you're comfortable in any way, shape, or form. You know, we'll position you however you need. So as a massage therapist, I will ask, you know, if you have specific areas you want worked on, while also avoiding the port site, any site of surgery. Light pressure will be used, and sometimes you'll feel us just sort of holding at a certain spot. I promise you, we're still working and we're still doing our thing. Our goal is to help calm you and to get you through everything that's going on. You know, I've seen it with my aunt. My aunt underwent chemotherapy and radiation and everything. It's one appointment after another, with pokes and prods and everything else. This is one thing that doesn't have the pokes and the prods, and we're just here to let it all go and let it be. And yeah, the one thing I do tell people is talk to us, let us know what's going on. If you need, you know, if you need something moved, if you need any kind of different work done, let us know. We will help change what you need done. Length of massage can also be shortened or lengthened. Energy levels can be different from day to day, and you may not have the energy for long massage on a day, and that's okay. We're here to deal with that. It's not an issue. Let's see here. So once the massage is done, I will usually leave my room, get up, get dressed, get cozy. When we come back in, we will check on you and make sure you're okay. Because in the end, we want you to be comfortable. And, you know, make sure you drink lots of water. As some people say, we are, you know, plants with emotions. We need sunlight and water to keep us sort of together. And, you know, check in with yourself throughout the day and the next day. The effects of massage do that. The time it keeps us together, like the time of recovery is different for everyone. Sometimes it only lasts, the effects of it only last a couple of hours. Sometimes it can last days. And, you know, it's a nice break from living in pain. It's not a cure-all, but it helps. And sometimes it's the small things that help. So there is a lot of research. We have gotten more and more research into oncology massage. Oncology massage itself is a fairly new thing. It's only been around for about 20-ish some years. But with research, it does actually help keep information current, and it lets us know that, hey, this does actually work. And this is something that we can share with your doctors and other medical staff to, to show that, pain can be relieved, even if just for a little bit. It also allows the therapist to know more about specific conditions that may be encountered, because we get a general knowledge of an overview of cancer, but there are some specific things that may come up, surprisingly, that we didn't go over. And so research is great for that. So as you can see, between 1900 and 1990, there was only about 32 research papers. Between 1991 and 2000, that grew to 294 per year. And between 2006 and 2008, there were like over 1,000 research papers per year, which is kind of cool. It means that we're growing and more knowledge is being received. If anyone wants resources, some online places that you can find information. The Society for Oncology Massage is a really good place to find research for oncology massage. I also got some information from like the Mayo Clinic and then the American Cancer Society. And this Why Not Wellness is actually me. That's my website. And I usually post different resources on that website within itself. So that was actually a fairly quick run through of what oncology massage is. Does anybody have questions? How do I stop sharing?
Yeah, so we'll stop sharing and we'll end the recording here.